I started stealing my dad's cigarettes at probably the 3rd grade. Everybody smoked, so it was just a common thing. Never really thought about the consequences to it, and I never really considered the damage that it could do.
So Dave's smoking history was kind of typical for his age demographic. He wasn't super excited to have lung cancer screening done, and that's not an uncommon thing. Most people are really nervous about lung cancer screening.
Well, I made an appointment, and the first person I saw was the nurse practitioner, Aimee Strong, and she sat down and informed me of all of what they've discovered. There was a cancerous growth in the lower lobe of my right lung, and that was frightening. You know, I thought, what did you do to yourself?
So we were able to get Dave in to meet with one of our thoracic surgeons, Dr. Phil Carrot, and Dr. Carrot very quickly was able to get Dave to the operating room to actually take out that part of the lung where that cancer was living. The recovery from our minimally invasive surgery is very quick. People are usually in the hospital a couple of nights. And for Dave, surgery was curative for him. He did not need to go on to get any sort of treatment afterwards, no chemotherapy, no radiation therapy. We simply follow him with CT scans of the chest every 6 months for 2 years, and as long as things look good, we'll get a scan once a year thereafter.
I go in there every 6 months wondering, is it coming back, is it gone? But it's always so nice to have Dr. Carrot or Aimee sit there and say, hey, it's all good. And I have been cancer-free for almost 2 years now. After the surgery, I was coming out of Dr. Carrot's office, and I thought to myself, what is it that I could give back to this place? Because I was elated that I had a chance to survive. And as I was walking out of the cancer center, I thought, well, maybe I could be a volunteer. I wonder if they have volunteers. The thing I like most about volunteering is supporting people that are fearful, anxious, and attempting to let them know that they're cared for here, and that if there's anything they need, ask anyone that's employed here, and we'll help them. I was hesitant to get screened for lung cancer because I was afraid to know what damage I had done. I attempt to suggest to people who smoke that they get a CT scan. Have the courage to take the initiative to find out what it is you need to know about your own health. It might save your life.